Thank you, Congressman. Thank you, all of you, Mr. Mayor. Thank you, Assembly members, Senator. Thank you to Councilwoman and, of course, members of the County Board of Supervisors. Joe, thank you for assembling all of us here today, and it's an honor to be back with all of you. I just wanted to quickly update you on where we are in this pandemic and where we're going. I want to level set in terms of the progress that's being made in this state, the progress that we're also making on behalf of each and every one of you here in the Central Valley, and in particular here in Fresno County. First, let's just begin with the top line numbers. A month ago today, we had 13.9% positivity rate here in the state of California. Today, we're down to 4.8%. 13.9%, 30 days later, 4.8%. 30 days ago, we reported just shy of 50,000 cases of COVID in the state of California. Today, 8,400. We're seeing progress in every category, including hospitalizations. Hospitalizations in the last 2 weeks are significantly down. 34% decline in hospitalizations over the last 14 days, 28% decline in the number of people in our ICUs. We're seeing testing continue across the state, and that testing is providing us a sense of the community spread. That's also led us to a deeper and greater understanding of variants. The issue of mutations is top of mind, not only here in the state of California, across this nation, but increasingly around the globe. Important to update you on what we know. We have 30 state genomics labs that are doing isolate testing. Over 12,000 isolates have been sequenced here in the state of California. We currently, as I speak to you, we have 159 identifiable cases of the UK variant in the state. We have 1,203 identifiable West Coast variants in the state. There are two types of West Coast variants. I said yesterday that we had not identified any Brazilian variants, and that's true. Yesterday, I also said we hadn't identified any South African variants. That's no longer true. As of a few hours ago, we have the first reported cases of South African variants. 2 cases have been reported through Stanford, one in Alameda County and one in Santa Clara County. So 2 variants that we identify as South African variants now are in the state of California. So I say that to make the point. Tremendous progress. 50,000 cases down to 8,000 cases. 14% positivity, now down below 5% positivity. Isolation issues related to ICUs and issues related to hospitalizations trending and moving in the right direction allowed us to lift that stay-at-home order in the state, and now we're continuing to progress people through these tiers. Yesterday, we announced more counties moving out of that purple tier, and we anticipate within a week or 2, even more counties moving, as that will force, or rather allow for, the reinstitution of opportunities for businesses to open with more capacity, and as the mayor rightfully said, to get our kids back in school, a top priority for all of us, particularly parents like myself with 4 young kids. Update briefly on schools. We're working with the legislature on a $6.6 billion early action package. Progress is being made. As I said yesterday, I maintain confidence that we will announce a deal as early as Friday with the legislature that will allow our youngest cohorts to return safely to school, starting with kindergarten to 2nd grade, and ultimately get cohorts up to 6th grade, at least in that first phase. We continue to make progress in terms of not only those negotiations on school reopening, but also on more small business relief. I noted just yesterday that we closed the door on the 2nd round of applications for state grants that we're providing, $5,000 to $25,000 for small businesses. That was part of a $500 million appropriation. We're looking to triple that and potentially even do more with the legislature. And we're hoping as early as next week to move early action in that space. And that will provide billions of dollars in direct grants and aid to not only our small businesses, but also provide support for nonprofits and cultural institutions here in the state. So a lot of activity, working with the legislature, a lot of energy, and most of that progress will manifest with early votes as early, we hope, as next Tuesday and later into the week, the end of next week. Now let me come back to Central Valley. Let's talk specifically about where we are. I just had the privilege of meeting an 85-year-old former farm worker. She just received her second Pfizer shot. She's here with her husband as well. She represents now the 5 millionth person that's now been vaccinated here in the state of California. We have crossed the threshold of 5 million people being vaccinated. I want to put that in perspective. On Friday of last week, we announced 225,000 vaccinations over a 24-hour reporting period. That represented 4 million mark. In less than a week, we've now reached 5 million. It took us about 7 days to go from 3 to 4 million. You get a sense of the progress that is being made, this flywheel in terms of the distribution, the application, the administration of the vaccine. Real progress is being made. We announced new vaccination sites just this week up and down the state of California. Last week, a partnership with FEMA and the California Office of Emergency Service and the Biden administration, 2 sites, one Cal State LA, one site in Northern California, Oakland Coliseum, focused exclusively on the issue of equity, geofencing, the geographic areas in and around those sites to make sure that underserved and underrepresented communities are getting their access, fair access, and distribution of these vaccines. Our commitment to equity is not rhetorical, it's real. But let me make this crystal clear. From all the reporting you've seen at the county level, and the state will be putting out the aggregate of that county data later into this week as it relates to demographics, we are falling short of our goals of making sure that we truly are being equitable in the distribution and administration of this vaccine. I am proud of Fresno County. I'm proud of the mayor. I'm proud of the supervisors. I'm proud of the assembly member, senator, and I'm proud of your congressman for their commitment, not passing interest to the issue of equity. It was noted a moment ago, a pilot project, 3,000+ farm workers that have had vaccine administered in a pilot that's now just concluded. We are committed to working with the Biden administration to land on a date, because I know you want a date for when we have a mass vaccination site here in the Valley and a location. When we have that information, I'll provide it. When you ask me, I'll repeat what I just said. When we have that information, we will provide it. Our commitment, our resolve to provide you that support is real. We've had very advanced conversations with the administration. That's why we were confident in socializing that effort. And we are making sure that we do it in a timely manner. But we're not waiting. Today, we're also announcing an effort to take our OptumServe sites. We have 20 of them throughout the state of California that have been doing a lot of testing on the basis of equity. And the first OptumServe site now for vaccinations will be at your city college in the next few days. And again, focused on equity. So this is the beginning of an effort to streamline, to focus, to re-energize this equity lens, working the farm worker community, working with small business, large business. Thank you, Foster Farms, for their efforts to vaccinate over 1,000 of their staff, which they did quite efficiently in this last week. But we have to do more. One of the areas where we're seeing progress is 2. We're seeing now commitment from the Biden administration, not only on these larger mass vaccination sites, but a commitment to community clinics, which are the backbone of the healthcare delivery system here in the Valley. The administration yesterday announced upwards of 1 million directly allocated vaccines to community clinics. That will also help the Valley in terms of access and distribution in a culturally competent way to those most in need. They're starting around 500,000 next week, and they'll get up to 1 million, of which California will receive roughly 10% of that allocation. Accordingly, we are about to receive 10% of another 1 million dose allocation, and that's directly to pharmacies here in the state of California. This does not come out of our broader allocation and supply. The partnership, again, the Biden administration with some of our largest pharmacy chains here in the state of California. 100 pharmacies are part of that project as well. Again, focus on equity, focus on census tracts, underserved communities. We also last week announced 110 community-based organizations receiving tens of millions of dollars in grants, in language, peer-to-peer, trusted messenger strategies to help deliver the message of the efficacy and safety of these vaccines. Many of those community-based organizations located not only here in Fresno proper, but in the entire region and in the Valley. And so that commitment will continue. This is just the beginning. This is not the end. There is no having made it when it comes to vaccines, but I will make this note because it's important. A week ago, you had 8,000 vaccines into this county. This week, you have over 19,000 vaccines into this county. It's not enough. No one's denying that. And I'll close by making the point that Congressman just made. The issue of vaccinations is an issue of available supply nationwide. The issue of scarcity is real. While there's light at the end of the tunnel, that's demonstrable in this state's capacity to already administer over 5 million doses. The reality is, at the end of the day, we're only receiving a little over 1 million a week. The last 7 days, we've averaged 181,000 doses being administered every day. The last 5 days, we've administered over 1 million doses. You get a sense of what I mean by scarcity. So when people say, where's the state sending the vaccines? We're sending them everywhere. They're out. The state doesn't hold one vaccine. There's not a vial in any warehouse. The state of California does not have any vaccine. We are part of a distribution strategy that comes directly from Pfizer to providers and comes from a third-party provider, McKesson, on behalf of Moderna and their vaccine to communities all up and down the state of California. We simply do not have the allocation that we need to get to the levels where we all need to go. 1.08 million last week we received, 1.08 million we anticipate receiving this week, and a little over 1.2 million next week. We have more work to do to get more supplies up. And as Jim said, the good news is come March, April, May, we're going to start seeing more abundance. We're going to see more availability, not only of Pfizer and Moderna, but also, as the Congressman said, J&J, the one-dose regimen, and the emergency youth authorization, we hope as early as the end of this month, and start to get those vaccinations into people's arms as early as next month. So light at the end of the tunnel, real progress across the spectrum, a commitment, not a passing interest, in the issues of equity, a resolve to make sure every part of the state is included. And to be here today is indeed an honor, particularly with all these extraordinary elected officials that have one commitment, and that is to you, your public health, and to helping us revitalize this economy, not only here in this region, but in this state. And for that, I'm here with gratitude and appreciation to each and every one of them. With that, we're happy, of course, to answer any questions.
Hi, this is Jocelyn with CBS 47. You mentioned the 19,000 doses a week we received this week. Can we continue to expect that in the coming weeks? And what about other counties such as Merced County, Madera County, other Valley counties? And there's just been this sense of the Central Valley being left behind. Given our vulnerable populations, ag workers, just many people who have underlying health conditions here, how much of a priority is the Central Valley for you?
Top priority, always has been. We've made that crystal clear. Equity is our guiding lights, our North Star, and we mean business about that. The pilot we've just done for the farm workers is a demonstrable proof point of that. The work we're doing, being here today, to help support the efforts that are already underway, this mass vaccination site, the announcement as it relates to how we're going to begin to convert these OptumServe sites in a strategic way, is another example of that. Our commitment to you to provide some clarity over the next few weeks, but again, with the reality that the state as a whole, a nation as a whole, is dealing with scarcity in terms of total number of available vaccines. We have a 3-week window of visibility on vaccinations. That's what the Biden administration is providing the state. That's what we are in turn providing to the counties. Here's a caveat. Next week, we are going to formalize our partnership with Blue Shield and Kaiser, third-party administrators, in order to provide more clarity, more transparency, and more accountability as it relates to the distribution of vaccines. And that will allow all of us in a granular way, not only look county by county here in the Valley, but more granularly within those counties to see how we're performing and to see that we're getting our fair share of these vaccines.
Governor Rich Rodriguez from Fox 26 in Fresno. First question, there are a number of people who are waiting on their checks from EDD in Fresno County. What kind of hope can you give them? If I can be so indulgent, this is a large sports community. People are back on the field, but they can't touch a football and they can't touch a baseball. When will that rule in?
We're looking forward to making announcements. I've been working personally, directly, with advocates that include my wife and myself to get youth sports up and going again. Again, I'm a father of 4 young children, 4 to 11. So forgive the personalization of this, that deeply are desirous to see youth sports competition return. Now, that happened a few weeks ago for track and field and a number of other sports. We're looking forward to updating the guidelines as conditions approve for baseball. And yes, I am not naive. I know where I am, know your audience. Also, I'm part of that fan base for football, which is more challenging, more complex, and we are in deep negotiations with advocates across the spectrum, including the Let 'Em Play Coalition, that have been outstanding in terms of not only providing evidence, but providing support to update our guidelines. When I say we're working overtime on that, what I mean by that is I'm hoping in the next number of days to be able to more specifically answer that question because of our commitment to let these kids back out on the field of play. That said, on the issue of backlogs, we went through backlog through a strike team at EDD. We identified 1.65 million backlogged cases. We were able to get through all but 110 of those, 110 from 1.6 plus million. And we've been able to close that backlog. And we're making real progress. But that backlog, again, is dynamic. That was the old backlog. Over the course of the last few weeks, we have cumulative examples, and I'm sure those are the ones you've cited as it relates to efficiently getting those checks out. But do not be naive that we have to do so in a way that addresses this rampant fraud we've seen all across the United States. So we want to do that with verification, and we want to do it with the sophistication of understanding that we have since last October when we began the process of changing our protocols as it relates to the distribution of the same.
Governor, you mentioned the City College, I believe. Do you mean Fresno City College will be the OptumServe site? And if so, how many will we get at that site? How many vaccinations daily?
Yeah, we're starting at 420 on the first day. We're building up from that. So get a sense, thousands a week. We want to do more than that. That's what we're starting. We'll get you the exact address and we'll get you the exact date. My hope is to get it. I have a date, that's the 18th. I'm hoping to deliver before the 18th. In fact, I'm confident we will. If you want to socialize this, say the 18th, but I imagine the chances are substantially high that we'll get it done before the 18th, but that's when we contractually have demanded it.
Can I ask if those doses come out of the county's allocation, and will the county's allocation remain where it is for this coming week, or will it potentially fall back down again?
Well, everything's dynamic. It depends on what the state of California gets. Again, state doesn't have doses of vaccines. The federal government distributes those vaccines through their networks. Again, McKesson and Pfizer directly. And so based upon what we know, yes, we can anticipate a similar amount of vaccines based upon what the federal government has told us in terms of the visibility over the next few weeks. As it relates to new vaccines, the community clinic vaccines will be additive. The site we will announce with the Biden administration will be additive. The efforts at the pharmacies will be additive. As it relates to the OptumServe, it will come from existing allocations.